So today we will be discussing the West Heaven criteria for hepatic encephalopathy. Now we know that this hepatic encephalopathy is extremely common in chronic liver disease patients, in acute liver failure patients as well, and in ICU it is extremely common those patients who have liver disorder. So this West Heaven criteria for hepatic encephalopathy is graded into uh, mainly four stages or four grades: 0, 1, 2, 3, and 4. So, whenever we see it is a grade 0, there is almost always very, very, very subtle psychomotor or neuropsychological abnormality which is there. So, it is very difficult for a relative to understand this. So, it is very difficult for a person to understand. Only doctors can very, very easily pick it through the testing, like calculations, through jogging their memory. Then only we can come to know that yes, there is some defect in the memory or there is some defect in the orientation. Otherwise, most of the time these patients can talk very well and they pretty appear almost normal. So grade 1 is that there is basically uh, usually shortened attention span in grade 1. So these patients tend to ignore, or they don't or they cannot remember the things pretty well. So if we ask that what I said earlier, like 5 minutes back or 10 minutes back, or who came to visit you, so they may not be able to understand or recall the thing. Or if we ask them some calculations like what is 9 plus 5, then 5 plus 4, and we can simply ask them ki what was the first number or second number. So because of the poor attention span, they may not be able to recall those things, even though they can talk to you kind of normally. So very commonly they have impaired ability to do simple math like addition or subtraction. So there will be impaired addition or subtraction or simple math things they will not be able to do. And these patients may be slightly anxious or they may have some altered mental status. But that is not that much. That is usually kind of almost towards the normal, though this patient tend to talk like normal people and they very commonly have altered sleep pattern. Means usually these patients don't sleep at night. They sleep during days and they don't sleep at night. This is a very common thing. In fact, this is one of the earliest thing, that is what is we call it as reversal of sleep pattern, which is seen in this stage 1 hepatic encephalopathy. When it comes to stage 2 of West Heaven encephalopathy grading, they very commonly have asterexis. Asterexis means the tremulousness of their hands. So whenever we say that to keep both the forearms straight forward against the gravity, there is tremulousness and there is tendency of falling of the both side of the hands. These patients very commonly have lethargy, so they tend to sleep a lot, or they tend to have apathy. Means they may not be able to talk to you in a very, very, very nice matter. Or very commonly, whatever emotions, whatever thing, whatever discussions we expect them to have with the relative or with the doctor or with the people around, they may not be attentive to that. So this is what mean by apathy. Very commonly in this grade 2, the patient can be disoriented with time. So they may not be able to understand whether it is day or afternoon or evening or 2 a.m. or 2 p.m. or this disorientation with the time is very, very, very common. And this type of thing, this type of abnormality is very easily picked by the relatives. And relatives also can very easily or obviously say that yes, there is personality change. This is not the way the patient usually behaves. So there is obviously the personality change is seen in, and that is seen in grade 2. So this personality change means the patients very commonly have inappropriate behavior. So these patients may pass urine in their beds, they may argue, they may have quarrels. So there is personality change. They usually do things which usually the patient doesn't do normally. So a person if is supposed to be very calm and quiet at house, very understanding, he may be very much irritable even at a smaller things. So inappropriate behavior or yelling or quarreling, these type of things, or becoming very restless, becoming very irritable, not listening to the doctors, these type of things can be very commonly seen, and this is very much commonly seen in grade 2 hepatic encephalopathy. When we come to grade 3 hepatic encephalopathy, usually patients tend to have somnolence or they tend to have sleepiness. So these patients, we need to make them awake either with the pain or with repetitive stimulus. So you may say that the patient may be in semi-stuporous phase. So whenever we give them pain or whenever we make them awake, they may talk for a while, but most of the time they are all confused. These patients are very much disoriented with time, and not with time, but also with the space or place. So they may say ki they are at their hometown or they are with their family members, and they don't usually remember or recall that they are in the hospital. So excessive sleepiness, the need of keeping them awake, this is very much common uh, in grade 3 encephalopathy, and they definitely may have very irritable or irrational behavior that is usually seen with the grade 3 uh, hepatic encephalopathy, that irritable, irrational, or strange behavior with this somnolence, sleepiness, or gross confusion is very much commonly seen in grade 3 hepatic encephalopathy. And grade 4, most of the patients will be in coma. And very commonly, the grade 4 hepatic encephalopathy has a very bad prognosis if the patient has CLD or if the patient has very refractory acute liver failure. So this is all about West Haven criteria or grading for hepatic encephalopathy. That's for all for now. Thank you.